literally everybody was saying it is either more difficult or way more difficult to recruit and find people. And it's relatively clear that they're trying to take the economy in a slightly different direction. Yeah, that's a good one. I don't have a crystal ball, unfortunately.
Hi, and welcome back to Engage Care Talent. We're all about solving the care talent crisis one conversation at a time. I'm Chris LeCant-Howard, I'm co-founder, and I have my fellow co-founder with me as well.
That's me, that's Rowan. Welcome back. And today,
stuff.
We've got the guy in the red jumper. He's back again.
We have.
Julius, how are you?
Yeah. Hi there, Chris. Hi, Rowan. Thanks for having me again. So glad to be here. I'm Julius. I'm the European Labour Economist working for Appcast. Appcast is a company that is doing programmatic recruitment. And we are part of the Stepstone family, and Stepstone being obviously one of the largest job board companies in the world. And so as the Labour Economist, I'm doing a lot of analysis. We also have a blog, and I write about economic developments, labor market developments, and basically how the economy is affecting recruitment and the labor market.
So I still remember we talked on the last episode, and anyone who wants to watch that, definitely pop on to Engage Care Talent and check it out. But what your routine would be like in the mornings, going on to checking the news, checking the state of the markets, etc. And I think while we wouldn't expect all of our listeners to do that, it's certainly worth them being part economist, a little bit Julius about understanding what's going on. So it's great to get you back again, because I think it's something we will turn to throughout the year is just getting a sense check about where things are with the economy and what that means for anybody in the business of attracting and engaging talent, especially in health and social care. So I suppose natural thing is, goodness me, how's it been the last 12 months? What's your kind of view on things about how things have gone?
Yeah, so if we look at the UK economy, I think there's two things that kind of like stand out to me. So the first one really is that if you look back when we spoke almost exactly 1 year ago, I think a lot of economists at the time were expecting kind of like that the shallow recession we were in 2023, that it might continue and that the economy might continue to perform actually quite poorly. And the good surprise is actually that the UK economy came out of this like shallow recession this year, and actually economic growth kind of surprised on the upside. So if you just look kind of like at business activity and economic growth, actually we've been doing better than expected. Unfortunately, if you look at kind of like employment figures, the story is like a little bit different. So the unemployment rate continues to remain actually quite low. We are like at about 4.3% right now. But what we're seeing as well is that actually job growth has actually been pretty stagnant this year. So if you look at kind of like the last 10 to 12 months, there's not been very jobs created. The education sector and healthcare are a little bit of an exception. So since COVID, education has created quite a few jobs, the healthcare sector as well. Job growth has unfortunately been quite stagnant, and the number of vacancies in the economy also continue to fall. So hiring has been really slowing down the last 6 months.
Do you think it would be fair to say that this year, and I say this with like a tongue-in-cheek kind of thing, but this year has been fairly easy in terms of recruitment for companies?
Yeah, that's a good question. I would say there's actually surveys out there, like the Bank of England is actually going to recruiters and they ask them, is it how difficult do you find to recruit right now? Is it easier compared to normal? Is it harder compared to normal? If you had asked recruiters 2 years ago, is it easy or difficult? Literally everybody was saying it is either more difficult or way more difficult to recruit and find people. So that was in 2022 when the labor market was super tight. There was a record number of vacancies out there. Companies and recruiters struggled to find people. If you ask recruiters right now, it's pretty much back to normal. So it's definitely easier, much easier compared to 2 years ago. Is it easy? That probably depends a little bit on the sector, actually.
Okay, thank you. And then, what would you say if we were going to ask recruiters in 12 months from now? What do you think their response might be?
Yeah, that's a good one. I don't have a crystal ball, unfortunately. I would say that there's a lot of economic uncertainty actually right now. We don't know what will happen in the next 12 months. Part of the reason is that we just had the US election. I think that will have global economic implications. We're not quite sure yet what the policies of the new US administration will be, how they will play out. We'll have elections in Germany. France just got a new government. So then there's like the war in Ukraine. There is like things that happen in Syria. So there's a lot of like global economic factors, a lot of geopolitical uncertainty that is happening right now that can affect growth and might also affect growth in a negative way for the UK economy.
Yeah.
The one upside the UK has probably, and I've written about this, is that the UK is not that manufacturing based anymore, right? So if you look at Germany, my home country, we are producing a lot of stuff. We're producing a lot of cars. We're producing a lot of like machinery. We're exporting it to the rest of the world. A trade war will really hurt Germany quite a bit, and we're already seeing that right now. Whereas the UK, actually, it's interesting, is the one country right now, one big country that is exporting more services than actual goods. And so, what is a service? That would be UK lawyers jumping on a phone call with international clients. It would be UK consultants jumping on a phone call with international clients. It could be M&A advisories. It could be me as an economist, if I were to do it in my free time on the weekend, jumping on calls and billing international clients. That would be theoretically a service export, right? And so the trade war will not really affect it that much, actually. So the UK might actually be a little bit more immune from all of that compared to continental Europe. So long story short, I think at some point in time we're a little bit in a slowing down phase, but I do think that job growth and recruitment will hopefully pick up again within the next year, and that the UK will kind of like not be as affected by some of these factors that are hitting Germany, for example, right now.
Yeah, that's really interesting. The other thing we covered this time last year was there'd been a big spike in salaries, hadn't there? And I remember you kind of explaining that actually there was a lot of catching up on salaries rather than kind of necessarily overinflation. What are salary increases like now? Are they kind of have they plateaued off, or have they continued to climb?
Yeah, no. So wage growth is coming down a bit. The UK is still a little bit of an outlier in the sense that if you look at the US or again the Eurozone, wage growth has actually slowed down significantly. We kind of like came out of this inflationary episode of like 8, 9, or even 10% inflation. Inflation is basically back to normal in the Eurozone. Inflation is back to normal here in the UK. But the UK is still seeing some 5 to 6% wage growth on average across sectors, which is actually higher than what we are seeing in the US or in Germany. Again, it's kind of like very sector dependent. So if you look at white collar occupations, I've mentioned consultants before, project management, marketing, a lot of these white collar roles, they have seen a more significant slowdown, and the number of vacancies in that space have declined significantly. So wage growth in that space is actually lower, whereas for blue collar occupations, wage growth is still a little bit higher. So anything that is like might be a standing up job, like you work as a barista in a coffee shop, you work in retail. Actually, the healthcare sector might also still see slightly higher wage growth. For these occupations, wage growth is still maybe around 6-7% in nominal terms, which is quite significant. And so obviously there's like two things to keep in mind here. For workers, that is actually good news, right? So inflation is at 2, wage growth at 5 or 6%. So they are finally getting a good inflation adjusted paycheck again. Their salaries are increasing at a rate higher than inflation. But for the Bank of England, that is slightly bad news, our central bank, because in the long run, they need to probably bring that in wage growth a little bit further down to hit their inflation target.
No, obviously there's this thing also about there's a new Labour government in for the first time in 14 years, and the autumn budget landed, and also there's this context of promise of a decade of national renewal, and that the autumn budget will be the worst one by the current government. So what's your view on the impact of a new government coming in after 14 years, and particularly, let's be honest, a Labour government, and what that means, and the impact of the autumn budget and what that means for, I suppose, in particularly kind of health and social care for the next 12 months?
Yeah, so the autumn budget, I think, was actually quite significant, not just because it was the first budget set by Labour in more than 14 years, but also because of the policies they have implemented or they are implementing. And it's relatively clear that they're trying to take the economy in a slightly different direction than the previous governments, right? But they are also in a little bit of a tough spot just because the UK debt levels are already quite significant. So the debt to GDP ratio is close to 100%. Historically, if you look at the last few decades, that's quite elevated, right? But so what Labour did is that, first of all, they are trying to increase public spending. They want to increase public spending on education, on infrastructure, and so on. And they're actually going to do that to some extent with extra borrowing. So is that probably that's good news, because definitely there are infrastructure needs here in the UK, right? Like we do need to fix some of our infrastructure. The NHS needs a higher budget, and so on. So that's the good news. But also if you spend more, that's slightly inflationary. And at the moment, the Bank of England will just keep interest rates higher for longer to offset this inflationary effect. So you get slightly, basically, you get a little bit more public spending, but because of the higher interest rates, you get a little bit less private spending to some extent, to be honest. And they will, to some extent, offset each other. But the public spending is probably still necessary. For recruitment per se, the two bigger effects were actually the changes in the minimum wage, again, and the changes in the national insurance contribution on the employer side. Let me start with the minimum wage. So I'm an advocate of minimum wages. I don't want workers who are in like if you go to a coffee shop or whatever. I think everybody should earn. Like we cannot have these workers get just like very poor wages like that. Like it's not good for society if we have like some people who kind of like barely get by just because they are paid so poorly, right? But the small worry is that if you look at the minimum wage over the last 10 years, the last 7 years, it has increased by almost 75%. So that's a massive hike year after year. and wages in the middle have been more stagnant. And that means that we are actually having quite a bit of wage compression in the UK. If you look at wage inequality, it's actually gone down. And so now we're getting to a situation where the minimum wage has increased by so much compared to other occupations that it might actually negatively affect recruitment, especially in, let's say, lower income regions of the UK. If you think about, like, maybe, let's say, pubs in the northern part of England or whatever you have, at some point in time, it will become more costly and more painful for these businesses to employ people just because the minimum wage is so high. They might not fire people, but they might just reduce working hours and so on, just because their wage bill is increasing at such a high rate. Right. And so then we have the increase in the national insurance contribution. Labour increased it to 15% from 13.8, I think, previously. And if you look at people who are earning around £30,000 per year, that's roughly an increase of £900 that the employer needs to pay in additional national insurance contribution per worker. So that's a quite significant amount, especially for businesses in retail, in the food and hospitality sector, businesses that have low profit margins. It will also affect businesses in the healthcare sector, right? So if you think about care homes, these are not, care homes are nowadays expensive, but these are not super profitable businesses. It's not like the tech sector with massive high profit margins. They're expensive because they employ a lot of workers. And if these workers get more costly because of the NI increase, then recruitment will probably go down, or they have to pass along these costs to the consumer.
And what about the cost of living then? So is the cost of, so have the wage increases like minimum wage, have they gone in line with the cost of living, or is cost of living still continuing to be a growing issue that's growing faster than wage increases?
Yeah, I would say, I mean, definitely 2 years ago, in 2021 and 2022, inflation was at a peak of over 10% here in the UK, right? And at that point in time, inflation was higher than wage growth. So people were hurting. But right now, we are finally back to a situation where actually wage growth is exceeding inflation. So people are slightly better off, and I'm hoping that this at some point in time will be also reflected in kind of like better consumer sentiment. We are already seeing that, and also in like higher consumer spending, which the economy needs right now. But if you look at wages, kind of like at the bottom of the distribution, as I mentioned, because of the minimum wage hike, if you look at sectors in the food and hospitality sector, retail, wages are growing still at a rate of 5 to 6%, and that's higher than inflation. So there are a lot of workers who are getting a real wage increase right now, which is a good thing.
Okay, so I suppose health and social care and it still remains and should still remain to be quite a safe sector in terms of job security, right? So if you're working in a pub and you might get your hours lessened or whatever, that's very unlikely to happen in a growing sector like health and social care or education. So they're still people refer to them as kind of bulletproof sectors. I won't necessarily go to say it that far, but even with the rise in national insurance, you'd still like to think that your jobs are fairly safe in health and social care. Is that right?
Yeah, no, definitely. I would say your jobs are safe. I think it's more affecting recruitment, right? In the sense that it will have a negative effect on kind of like additional jobs being created. I don't think employers will necessarily have to let go of a lot of people, have to lay off a lot of people because of the NI increase. I don't really see that. I think it will just affect recruitment in the short run, and to some extent it might affect prices as well, because as I previously mentioned, if you're in a low margin if you are in a low margin sector, then you might just have to pass on some of the additional cost to consumers.
And actually, there'll be a natural, increased reliance on technology to try and bridge that gap, and increase cost efficiencies. I suppose you can see that in retail, in service sectors, and I think there's lots of impact there. When it comes to health and social care, while there will be impacts of technology, I think there's a good opportunity to be looking at those sectors that may be releasing employees' workforce due to increases in technology, which is a good opportunity for health and social care. But the challenge is there, of course, is making sure that those people see a career in health or social care as being a viable alternative to working in retail or working in whichever industry.
Yeah, that's a good point. I definitely can see that you could like attract basically the workforce from other sectors. It definitely during COVID that happened to some extent, right? If you think about the lockdowns that we had for a month at a time, the hospitality and food sector was suffering, and people were leaving that sector. Then everything reopened again, and people were coming back to that sector, right? So there was a lot of churn, and you can always try and should also attract employers from other sectors. And if you think about automation, where might it be happening because of the minimum wage increase? You're totally right that for some food and for some businesses, if we think about like going into a McDonald's or KFC, etc., where you have like these self checkouts and so on, like you can see that like for these businesses that they will implement them more and more, which to some extent basically it's automating the workers, and they will then have to go somewhere else, right?
I've got one more question I can think of, which is around advice for people who kind of run talent teams or are responsible for talent attraction strategy for large and small health and social care organisations. So there's been I think that recruitment has been slightly easier this year. There's been a huge influx of kind of organic and free job applications from certain job boards that kind of come into the market and make it a little bit easier. Um, if you were in that position and you were planning your budgets for next year, everybody kind of tries to top load January because that's the typical peak time for recruitment. But would you say that there's going to be kind of because obviously you've got the data that you work with at Stepstone, but would you say that the kind of Q1 of next year is going to be a prime time for recruitment, and that you would expect it to kind of peter off a little bit in the summer as per usual? Or do you think there's going to be changes in the market this year that mean that actually it's going to be a little bit tougher to find quality applications?
Yeah, that's a good one, and I'll be perfectly honest. I'm not 100% sure, just because I'm also not 100% sure yet how businesses are responding now to the NI increase, right? So I do think that some of these businesses are just like at the moment crunching the numbers, seeing like how much it will affect them, how much their wage cost, their wage bill is increasing due to the policy change. And what we're seeing right now is that hiring has definitely slowed down. I can see that things might still be a little bit slower than usual, potentially in Q1 of next year, kind of like dragging into Q2. If you are a businesses that basically though has the option to hire people and is looking for people, then that might be the time. Then that might be easier for you. So that
Yeah.
might be then you would be a good idea for you to swoop in, and because you'll have an easier time. It's not as hard anymore. You don't have
Yeah.
to compete as much as 2 years ago, right?
Okay, so I suppose the advice to those kind of, especially in health and social care, is that actually Q1 could be a really good time to build your talent pools and
Yeah.
to go out quite aggressively to attract staff, because there's uncertainty in
Mhm.
other sectors, and other sectors might be a little bit slow because they're still counting counting the numbers to see, if they're going to be brave enough to grow next year. Yeah, that's fair to say, isn't it?
That makes sense. Yeah, definitely.
Well, I think, so there's considering, looking at the next few months, you see the impacts of the rise in national insurance. We're going to be looking at things like the NHS 10-year plan being released in springtime, and finding out more about what the government's plans are for the NHS. So I think we'll definitely be coming back to this. It'd be good to get you back on, Julius, and chat about it more, because I think it's really valuable to share this with our listeners, definitely. So yeah, thanks very much. Really appreciate it.
Thank you. I have one last question though, just quickly. So what are you hoping for Christmas, Julius?
Oh, I'll actually be in Czech Republic with my wife for a week in a town called Karlovy Vary. It's like this spa town, 1.5 hours outside of Prague. So I'm
Lovely.
just hoping for a relaxing time in a hot tub, basically.
That sounds amazing.
Nice. That sounds good.
Yeah, you make sure you achieve that, and yeah, let's speak to you again. Into next year to see what your view is then and see how things are going. And we might be able to bring some data from other kind of clients who are working in health and social care to see actually how recruitment is going. I think it'd be quite interesting to reflect on that.
We'll do that. Thank you so much for having
Amazing.
me, Chris and Rowan. Thanks.
Hey,
Thanks,
pleasure.
Julius.
Thank you.
Cheers. Bye now.
Cheers, guys.